without any more stories or anything right now, I will introduce you to Dr. Bob Sparks, and he's going to tell us about Pioneer Medicine, and I'm thrilled that he's getting to be a part of the Sherry Stodgel Fowler lecture series.
I will get even with the subject. Some way, somehow. I could probably clean up some of those flies. I wrote some notes, and I've got a lot of frontier medicine things here to talk about. Let me explain to you why I have one eye. I drive too fast, often. And this was a Jeep, and I apologize. I only used one of these glasses. Nevertheless, this morning, before coming up here, I had a phone call, literally on my way up here, from a classmate of mine, Billy C. Billy and I played football together in Rockwall. He and I were just rough kids. That's the nicest way ever. We were rough kids. But we were going around our senior year looking for an elective class. And we looked in home ec. That's too much work. We drifted past Billy Stevenson's class and said, this is it. All they're doing is sitting there at the typewriter, there's girls everywhere. So Billy and I sat down. Good to see. Billy Stevenson comes up and puts a chokehold around me, whispers in my ear, you're going to learn to type. It probably was the single skill I got out of school here that helped me through life, through high school, college, medical school, residency, and I'm still typing it on my keyboard at my desk in my office now. Billy said to me, well, I'm not going to college, I'm going to Vietnam, and so he joined the Marines. San Diego's getting on board ship, all of his squad, all thousands of people getting on board ship. Somebody yells out, does anybody type? Well, Billy raises his hand, and sure enough, a guy from Chicago made two guys out of all those boys, made stateside clerks out of them. Well, Billy's squad shipped off to Nam, and they were all killed on First Beach. So typing is as simple and as benign as it seemed to change both our lives. And I thank Billy Stevens for that. She didn't get the So many things. This little story about sewing up. My mother died when I was 10. My brother and I grew up differently, but similarly in some way. We both, I don't know how we became physicians, but Randy didn't get up easy, and in the middle of the night when someone was injured, my dad would wake up one of us that would get up and help him in the middle of the night. I always would get up and go over it. So I was on the other side of the table, taking care of trauma since I was 10 years of age. And that was everything that you can imagine. What we did a lot in the summers was take care of agricultural accidents for farmers. And that would be an amputation of a finger or something, a laceration, always a dirty wound. But the farmers were interesting around here because they didn't want it cosmetically pretty. They wanted to roll that flap of skin there so they could keep on working. And they did. But it taught a young kid a lot. I interned in Dallas at several different places. They had us rotating. But I enjoyed working at Methodist, delivering babies, and Baylor and Parkland. And we were rotating doing OB-GYN. Well, when my contemporaries, my young classmates discovered I had all this ER background, they begged me to take their ER call. I said, if you'll take this call. And so two friends of mine and I got licensed early. And so we were licensed physicians when we started our residency. And I would go down at Baylor and Methodist and Parkland ER and work, and then go to work. And my dad gave me a room across the hall from his, and I literally started work in 76. And 77 and 78 was when we finally finished the residency. So anyway, it was interesting. Growing up in Rockwall, this courthouse, for lots of different reasons, holds a lot of memories for me. That sounded pretty clean, didn't it? Well, when I was 9, I want to say on the floor below this, I had a shoe shine kit, and I would, on arraignment days for the prisoners, it was I think Tuesdays and Thursdays, I could make a quarter, 50 cents shiny shoe. This was good money. This was great. When I was 9, I also remember carrying my dad's bag upstairs so he could make rounds in the jail, which was another eye-opener, as it were. And I ended up doing that for 22 years. Now, it was a lot longer than 22 years, but I charged the county 22 years to pay me to do that, trying to get fired. And then I would double that. You got to pay me twice much. They wouldn't fire me, so I finally retired. But it was a lot of work. One thing that you wouldn't believe, but smoking. 85% of my budget was consumed by cigarette smoke and the complications of bronchitis and pneumonia and all the things that go with it that they were doing. And as soon as we got a sheriff that would not allow smoking, it was Harold Evans, that wouldn't allow smoking, all of a sudden they had money to take care of the rest of them. So anyway, those little things made a difference. Yeah, I've paid a lot of traffic tickets through these courts. Got a lot of stories there that I won't tell you. Across the street was the Rockwall drugstore. It was from here to there. My dad had his first office above Zanata's. Not Zanata's, but there was Cunningham Drugstore at that time. And above it was his first office in 1946. It burned, I think, in 51 or 2, and then he moved down and built the clinic where I am now. I'd like to say I've been there my whole life, but I hope not. The truth is, I was born at home. It's a little sticky subject. Why were you born at home, Bobby? Well, I think from the stories I've heard, my dad had stayed up too late with a couple of friends of his. We'll call them Stevens and Sevens or something. But, it was safer if he delivered me at home. My mother apparently was not very pleased with this because, first of all, my brother Randy was only 11 months older. And an Irish twin did not settle well with her. She was so angry with my dad, she named me Robert after her drunken father and Dale after her old boyfriend. So I grew up being called boy or son by my father. But Bobby's just fine. But the drugstore held a lot of memories too, because a lot of kids, we would meet there. They had a soda fountain. Down the street was Harvey Sanders Corner Cafe. In high school, we all ate burgers and fries, and if you didn't have money, you'd sign the ticket and pay him next time. I don't know how he kept the doors open, but it was a great place. This was a wonderful town to grow up in. I don't know that town anymore. There are a lot of you here I do know, and I'm so glad to see the Willis families, the Stodgeville families, my good Benbrook. Everywhere I look, I see the McCollums, people that hold my heart in jeopardy for all the things we've done and live to tell the tale. My dad's house. We moved from where I was born to next to the clinic, which my grandmother had bought this house, and when our home burned, we moved into it. Well, since there was not another parent there while my father was working, we seemed to gather there and live our own lives. After school, we played cards. As we got older, the cards got more exciting. There is actually, in 1962, a bomb shelter my father built during the Cuban crisis next door. We could go down there and not bother anybody and be as loud as we wanted to be. So it was interesting. W.J. Price allowed us to come up here to the courthouse outside and gather, as long as we picked up our empties and took them with us. Anyway, I hadn't planned on telling you all that. When I was about 8, my father took me with him on many house calls. A house call, I recall the first 1 or 2, he said, I want you to sit down and be quiet and shut up. I'll ask you questions later. There'll be questions to answer. And so I recall, he said, when we left the first place, he said, what did the room look like? What was on the table? How was the patient? Were they dressed well? Were they disheveled? Were they sick? What did they look like? And so my brother Randy and I grew up being asked these questions. Back in the old days when you could drive downtown Dallas and there would be somebody with a foot drop or somebody walking irregularly. He said, what's the diagnosis? What's the diagnosis? And you needed to learn those symptoms of tertiary syphilis, those symptoms of chronic obstructive lung disease. If you could see the way they were sitting and coughing and blowing up, there were so many things that are obvious to some of us. I don't think I want, I never did torture my children like this. Mary Jo's got the dietary, Amy's graduated as an RN, and I told them all not to do what I've done. But that's very painful to take the path I did, but it's the only one I knew. I have had a good time. I've enjoyed my life. It's been a little painful. The best part of it has been my wife, Tana, the last 29 years. If anybody deserves an applause, this one. Well, anyway, I'm supposed to talk to you about frontier medicine. Frontier medicine, my grandparents were doctors in the 1890s. One story, they took a covered wagon to Florida when they put in the railroad for the Keys, and they were giving away land, and you could grow strawberries and make money. Well, their first baby, I was told it died of diphtheria. My dad said it probably starved to death because they were starving to death. They kept the mules alive, loaded up, and went back to Illinois. They wouldn't let her in medical school, Nancy, but and it was an odd educational system then anyway. In the 1890s, the pioneer training was poor, and most of the formal education was a semester, 2 semesters in the cities. You could get it across, you could get classes from the mail. You could, usually they would sign up with a general practitioner or a surgeon or somebody, depending on what he called himself, and spend a year with him or 2 years with him, and then you become basically accredited. My grandmother couldn't get in, so she studied his books and made better grades than he did. So she didn't take guff off of anybody. Trust me, she didn't. She was tough. At 85, my dad insisted she come live with us, and man, she was tough. I think Randy and my dad were more afraid of her than anybody. And they probably should have been. I got along with her by getting her on the defense quickly. You got to get quick with her. Anyway, both my uncles were physicians. My cousin followed my brother Randy and I. My cousin Alan Groff and Randy and I practiced together, the three of us, a total of I think about 6 months before Alan said, that's way too many Spartans. And I don't blame him. And off he went to Dalhart. But he came back to his hometown in Pilot Point. Randy and I worked together for 20 years. There's a whole lot about me that you can get tired of in 20 years. I think it was probably a blessing that he left, but he's still doing locum tenens or practicing part-time. Going to Minnesota where he is right now and see his grandsons play football on October the 13th. I've never seen either one of them play football. Anyway, football field duty was interesting. It wasn't the 20 years I spent on the sideline as a designated doctor. James Cameron said, Bobby, Randy, Sherman can't get over the fence in the news field. Can you boys do it? So that's how we got elected to do the job. Anyway, I made a lot of football games with my dad, Randy and I both. And it wasn't 20 years, it seemed like forever. But 50 years, I had a meeting with the school board and I said, I'd like to take this opportunity to thank you and resign. We had a lot of doctors here, orthopedics, everybody wanted to be seen on the field. I had all the fun I could stand, but I've enjoyed that. I enjoyed football. It was really hard to be on the sidelines simply because when they came by, you wanted to do something, and you're not supposed to feel that way. So getting too close to it was a problem. When I finally came home and was in my own office, it was just like growing up. People are sick, you make a diagnosis, do the treatment, and see the next one. We've always been busy, and I appreciate the community's support. Let's talk a little bit. I've got to say that some frontier pioneer medicine. 2 things I want you to understand. One is that people are always complaining about diarrhea or constipation. So if you're constipated, you can basically boil any bark and strain it and drink that, and it'll do one of 2 things, if not both. That'll either cause you to have vomiting and the diarrhea, both. So you've got to decide when to use these things. They used to use strychnine, and strychnine is a very good medication for stomach problems, but the side effects are a little steep. Be careful about that. Interesting, in the Boy Scout book, or Boy Scout manual, it talks about sprains and fractures and splinting. Splinting, when you break an ankle, first thing it does is what? Swell up. Well, the nice thing is it swells up, and what that does is sort of stabilize the fractured portions of bone. The other thing is if you'll just simply wrap that up in something to continue to support, that's about all they've ever done. And today, if you can set a bone, you're ahead of everybody else, because a lot of people simply can't do that anymore. It was a common practice in my office. You got to be careful about casting. People don't like casts. They don't like to wear them to bed. They need to take a bath. So you'll see them come back in and they'll cut the thing off and you got to put another one on. So those times change. Gunshots. Have you ever seen one? They're pretty scary. I don't think I was in practice a month before a fellow was in a card game, I remember, and he lost all his money to a card shark. Well, he goes home and realizes it. He picks up his gun, he comes back. The fellow's waiting on him, puts 5 rounds in his chest. And they bring him to my office. I said, what do you want me to do? He's taking his last breath. I told him, you better say goodbye, because that's about all the time you got left. There's not a lot you can do with that many gunshots. Again, it's about where the bullet goes, what organs it hits, and the problems associated with it are bleeding. What organs it hit, neurovascular. There's a lot of things. In the Civil War, why were there so many amputations? Well, back when there was very low velocity, they'd put a great big old ball in this rifle, and at low velocity, and they would hit a leg or an arm. Well, it's a whole lot easier to just take it off than it is to try to patch up that big hole and get you well. You won't do it because the skin's dirty, the clothes is dirty, it's got powder, it's got the wadding. It's not conducive to healing, so they did a lot of amputations. Now, from World War I, II, Korea, Vietnam, the velocity of that missile, that bullet, has increased so much that you can use a very small bullet, the size of the tip of your little finger, and cause this much damage because of that velocity. So you have to take different approaches depending on the times, and they call it the terminal ballistics of gunshots. I don't like taking care of them much. They're a little too exciting. Snake bites. Here's something that I found interesting. The first thing, you don't want to get bit. 7,000 to 8,000 people are snake bit a year in the United States, and only about 5 people die. Why? Well, we do have some antitoxin or antivenom, but this is supportive care that you get. Now, yes, if you get bit on the fingers or something, you're going to lose a finger. No way around it. You can't fix that. I don't think they'll ever fix that. But yeah, there's 2 types of toxins. There's the neurotoxin, like the coral snake, but the hematoxins, like the rattlesnake, coral, copperhead, water moccasin. We got a lot of water moccasins. We should play with them. They weren't tough unless you could pull one out of that hole, sling it around, and pop the head off of it. Don't do that either. One thing that I remember my dad doing, and I think his dad must have told him, when you had smallpox, because I never really saw very many cases of smallpox, lots of chicken pox, lots of skin wounds. In the old times, in the frontier, pioneer medicine, they would take the gunpowder and pour gunpowder over these weeping pox lesions. Why? I thought, what are they doing? Well, first of all, charcoal is a great neutralizer of poisons. If you ingested some poison, they give you charcoal. And if it's mild to moderate poisoning, charcoal will assume that. It'll just consume the toxicity of it. 2, gunpowder had sulfur in it. Sulfur is an antibiotic, or still used as an antibiotic. You're in there trying to figure, well, they give it Bactrim. It's got sulfur. So gunpowder, it wasn't all bad news. And some of these would get better, and that was interesting. Some of the things I found that are local, chiggers. Again, well, he discovered that he had to have 20,000 cases to get it approved by the FDA, so we ended up with tan hands for a long time. But yeah, it was impressive. Childbirth. I can't tell you how many babies I've delivered in this county. I don't want to remember. My dad delivered about 3,000 at the clinic. The only calls that I got were from ladies that were having them at home. The last one I delivered was south of here, and it was a boy I grew up with. And he called me and said, "Bobby, my wife's having a baby." And I said, "Okay." And he said, "Now." Great. "Where do you live?" And he told me the house, and he wasn't there. He cut and run and went to his sister's house to call. So anyway, here's the lady on the floor, and here's the baby, and the baby's alive. So I ligate the cord and make sure the baby's safe, put the mother on the bed, and remove the placenta, and do all the things you're supposed to do. And I told him, I said, "Now go over here and get your paperwork done." Sure enough, 5 years later, they're bringing this baby in, trying to get an affidavit saying that this is not an illegal alien. It was illegal to me because they never took care of that kid. But I delivered him in the house, in the floor, in the car, in my clinic. I said, "That's enough. I've had all the fun I can stand. If I won't go to the hospital, you're going to deliver it on your own." But some of the best deliveries have actually been done by the midwife. And I think that with the experience that they've had, of course, you know, putting an axe under the bed's not going to cut the pain. There's a lot of things that will tell you that's just not true. Childbirth in Rockville has been exciting. Of course, the more children you had, the more people picked cotton for you. One of the things that I found interesting, if you had horses and you had a sewing needle, heat that needle up, pull out that tail, that hair through alcohol, and sew it up, put the skin edges together. One of the most beautiful laceration repairs with homemade sutures I ever saw. There was a black lady brought her granddaughter in, and she had cut the scalp badly about 2 weeks ago. And what she had done, she had taken the hair from one side and the hair from the other and tied it in a knot. And so I'm looking, untying all this. 2 weeks later, I cannot find the laceration. It was completely healed. I was very impressed. I tried that with a couple of lightheaded kids, and I couldn't get the knots to work. I'll tell you what, that was the most beautiful laceration I ever saw. That was great thinking. You can use that horsehair for skin tags, moles, just tie it around there. It'll fall with moles, stuff will fall off. Just don't let it get infected. I got one story to tell you. There's a friend of mine I play ball with that is named Mike. The senior class ahead of me, we used to go on trips. They went to Galveston. Well, Galveston suntan is a really bright red color. And the old wives' tale was used vinegar. Well, he used so much vinegar, he got the nickname Pickle. If you ever see this guy and you call him Pickle, he'll know what you're talking about. And I won't tell you his name. Oh, what else? The two bottom line things I think were, you hear the value of country doctors. You hear the value of frontier medicine. Frontier medicine was terrifying. The things that got doctors at least a decent reputation was that they would come to your home. They would be there usually to assist the family in preparing for the death. Because there's not a lot you can do when you get there and all the healing time is behind you, not ahead of you. The best thing that they could pull out of their bag usually was compassion and let you know they cared enough that you don't have to do this alone, that they'd do it with you. And I've made a lot of house calls and I've said a lot of goodbyes. It's tough on the doctor as well as the family, but honest to God, the best thing that you've got in your bag is compassion. I've enjoyed working here for the last 40 so years. I have enjoyed taking care of y'all and y'all giving me the privilege. I don't do you any favors. You do me one when you come to the house and to my office. If you have any questions, I'll try and answer what I can. Please.
Tell us about laudanum. What do you know about that?
Well, let me talk about a cough. Yes, ma'am. Laudanum is a combination of morphine and cocaine, actually.
Oh.
And it used to be over the counter. But if you had a cough, you could try all kinds of treatments. But usually alcohol and laudanum was the game in town. It would stop a cough. You give it too much, you just stop all the breathing. Alcohol is what they still use in most cough suppressants you get over the counter. Laudanum's hard to come by anymore. But it was given for many things. And later on, they moved laudanum up from a pain reliever, and they were looking for anesthetics. Alcohol is a really poor anesthetic. Usually makes them mean. Pain doesn't go away far enough. They started using cocaine, get a lot of pain relief that way, but that still doesn't put them out. But they discovered chloroform, and they, as time went by, some very brave people experimented with anesthesia. A lot of those doctors are dead, but they did a lot of good by discovering what could help. Other than the obvious laudanum, what other question?
Turpentine.
Turpentine. Turpentine, kerosene, I have you seen used for all kinds of pulmonary. Poultice, let's talk about poultice. What is a poultice? It can be mud, but it's usually some gooey substance applied to the chest. And what with it? Eucalyptus, sulfur, anything that could be inhaled along with it right there where your nose and mouth are was considered good treatment for pulmonary infections and probably was helpful. If you took some bread mold and that gooey stuff and put it on an open wound, the penicillin, which was contained in the mold, would take care of a lot of infection. And I think that it always had a good reputation, but that was bread mold. Anything else? Thank you for giving me the opportunity to talk to you.
I've got you mentioned that you still go on house calls sometimes,
Yes, ma'am.
and I know your dad did.
Yes, ma'am.
I was told by Sam Buffington several years ago that when any of the blacks got sick or hurt, that they had to just treat themselves until your dad came along.
Until 1946, my dad didn't see any pigment issues. He saw people that were sick. And you have to look at people in the jail. I don't care what color, there are still people that are sick. So I've made a lot of house calls with him, with black people. It was interesting because I knew everybody. The town was small. The white population was small, so was the black population. My mother made me pick cotton one time. I have some black people in that have done this terrible type of work. We've discussed things about it. The best thing that I ever found about cotton was I was too small to drag a big sack, and they had me in a trailer so I could work with suction. I was 6, 7, and the husk would break up, and I got it in my lungs, and it gave me an allergic response. I'm allergic to cotton, so I can't pick cotton. But my dad took care of the black population in the community. I knew a lot of black people, good people. I went to school with in 1966 when we integrated. It was really kind of interesting. The whites were afraid of the blacks, and blacks were afraid of the whites, and I wasn't afraid of anybody. I knew that. And I had 3 black friends and 2 white friends, and me and my black buddies had a great deal more fun than the other guys. So it's been great taking care of everybody. And thank you all for enduring me.
We appreciate you.